Dementia, an umbrella term for clusters of symptoms associated with brain decline, is fiendishly difficult to prevent or treat. That's because much is still to be figured out about the brain's machinery. However, new research raises the prospect of repurposing a common drug to fend off Alzheimer's, the most common type of dementia. Scientists have assessed several drugs for existing health conditions to explore their impact on dementia risk. They found that use of sildenafil, common brand name Viagra, was linked to fewer dementia cases in American adults. The research is published today in the scientific journal Nature Aging. Dr. Susan Kohlhaas, Director of Research at Alzheimer's Research UK, said, "Developing drugs for diseases like Alzheimer's, which attack the brain, is a costly process and can take many years. Being able to repurpose a drug already licensed for other health conditions could help speed up the drug discovery process and bring about life-changing dementia treatments sooner." While sildenafil is most well known as a treatment for erectile dysfunction, it's also used to treat high blood pressure in the lungs. In this study, researchers also found that its use is linked with fewer cases of Alzheimer's disease in American adults. Due to the conditions Viagra, sildenafil, is predominantly prescribed for, most of the recipients of the drug were male. While the researchers did look at the effect of sildenafil on females, there isn't enough information to be able to accurately draw conclusions about its effect in females, which account for the majority of Alzheimer's cases worldwide. Dr. Kohlhaas added, "The researchers have conducted lab-based experiments to give an indication as to why the drug may have impact diseases like Alzheimer's, but these early-stage experiments would need follow-up in more thorough tests." Importantly, this research doesn't prove that sildenafil is responsible for reducing dementia risk, or that it slows or stops the disease. The only way to test this would be in a large-scale clinical trial measuring sildenafil effect against the usual standard of care. It's important that all avenues for potential drugs are investigated thoroughly, and the only way to do this is to keep up momentum in dementia research through continued investment. If you want to discuss any treatments you are receiving, the first port of call is to speak to your doctor. What are the beneficial mechanisms involved? The U.S. researchers found high doses of the drug, exceeding recommendations, increased brain cell growth and reduced protein accumulation in lab studies of human tissue. People on sildenafil were less likely to develop Alzheimer's than those not taking this medication, based on personal medical data spanning 6 years and involving more than 23 meters individuals. Lead investigator Dr. Fei-Shang Cheng said the findings were encouraging, but no definitive conclusions can yet be drawn, because our findings only establish an association between sildenafil use and reduced incidence of Alzheimer's disease. We are now planning a mechanistic trial and a phase 2 randomized clinical trial to test causality and confirm sildenafil's clinical benefits for Alzheimer's patients. Proven ways to reduce your risk. Although it's still unknown what triggers Alzheimer's disease, several factors are known to increase your risk of developing the condition. Age is the single most significant factor. The likelihood of developing Alzheimer's disease doubles every 5 years after you reach 65, says the NHS. But it's not just older people who are at risk of developing Alzheimer's disease. Research shows that several lifestyle factors and conditions associated with cardiovascular disease can increase the risk of Alzheimer's disease. These include smoking, obesity, diabetes, high blood pressure, high cholesterol. In addition, The latest research suggests that other factors are also important, although this does not mean these factors are directly responsible for causing dementia. These include hearing loss, untreated depression, though depression can also be one of the symptoms of Alzheimer's disease, and loneliness or social isolation.